Now, today marks World TB Day, and actually 2017 is the second year of a two-year Unite to End TB campaign for World TB Day. Now, the burden of TB in Kenya is much higher than before because out of 1,000 people, 6 people are said to be suffering from TB. Now, that was not the case in 2013, and I went on to speak to Dr. Eunice Omesa from the National TB Program and Dr. Martin Sirengo from the head of NASCOP and a survivor of TB, Mary Mutua, to understand what is going on in as far as TB cases increasing and how to detect and treat them. Listen in.
TB is an infectious disease of interest because it is one of the leading causes of death worldwide and in Kenya. TB is an important disease to talk about because just as the prevalence survey that has been released today, we are seeing about in every 1,000 person population, 6 people have tuberculosis. And cases are going up could be because, one, from what our prevalence is telling us, we translate that about 138,000 people are infected with TB annually. Yet, as a country, we've only detected 80,000 as of 2015, meaning we're missing about 40% of the cases. So in as much as the cases are going up, key to note is that we are missing a bigger proportion of patients or population that could potentially have tuberculosis. What this means is that this population is a pool where transmission is ongoing, and hence they continue fueling the spread of the disease, and this would now translate to more cases.
Okay, now, Dr. Martin Sirengo, I have to reel you in on this one. What do you think we're missing out on? Why are we increasing instead of going down? Because in 2013, we seem to have good news, but it seems to be taking a turn for the worst.
Thank you, Gladys. Indeed, the findings of this survey that was released today have gotten us thinking on how to do business differently. Of course, in the past, focus has been on those with symptoms of the disease, to be able to screen them, diagnose them, and put them on treatment. But what we are seeing right now is that we have a lot of cases of TB among people that we actually, in the normal circumstances, we do not suspect them to be having TB. So what that means then is that everyone should be able to go for a screening test for TB. So to begin with, every patient walking into a health facility now needs to be screened for TB because they have what we call latent symptoms, that are not yet out to be seen for us to be able to carry out tests and treat. So that's what we'll focus on.
Mm-hmm. And speaking of living without knowing you have the disease, Mary, you said you did not know you had TB. How did you find out you had it?
Okay, thank you for having me here. Okay. I'd actually gotten admitted to hospital for something different. I had a dehydration. So during the checkups, when the doctor was doing the rounds, he felt my chest and he felt there was something not right with it. So he sent me to get an X-ray, and that's when they discovered I had TB, which I actually had no idea that I had.
Yes. How long did the treatment of the same take?
Okay, just took 6 months. Because after I was discharged, I told them I would not take my medication there. I had to go to LV City Health. That is where I go for my clinic. And that is when I began my medication, which lasted for just 6 months. Yes.
Okay. So, Dr. Eunice, if she did not know she had it, the probability of actually, passing it on is higher because we know it's an airborne disease. So what are some of the symptoms we should look out for, so that we at least can curtail the increase of the same?
Okay, first she has brought out an important finding that was also picked from the prevalence survey. This survey was conducted among the general normal population. These were people who did not have signs or symptoms of tuberculosis. However, the burden of TB was found to be 80% of the patients who had TB did not complain of any signs and symptoms. So that clearly tells you that the larger population that is diagnosed or goes undiagnosed with tuberculosis is actually fueling the spread of the disease. So important to note is that screening of TB should actually be conducted even in the general population who are deemed to be healthy without necessarily having signs and symptoms of tuberculosis. However, that notwithstanding, it is important to note that certain symptoms should be pointed towards diagnosis or towards someone suspecting to have TB, and this includes cough of any duration. Previously, we said cough of 2 weeks or more than 2 weeks, but the survey has revealed that cough of any duration actually should be one of the key indicators or one of the key things that a patient should be suspected to have TB with. And weight loss, chest pain, okay, someone who presents with respiratory signs like difficulties in breathing, say for example, basically other respiratory symptoms, patients should be screened. And I like that she's brought up the fact that she went to a facility without necessarily having any complaint for TB, but the doctor was suspicious enough to screen her for tuberculosis, and that is what we're encouraging, active case finding in facilities. For any patient who walks into the facility, they should be screened for tuberculosis.
Now, that sounds like it needs a lot of resources to get it done. So, Daktari, the Ministry of Health, are you getting any help from there, or how are you reeling them into this?
Thank you. Thankfully, we have collaborations with our partners whom we work with. Of course, the biggest contributor to the health response is the Ministry of Health. But we do have our partners that we work with, whom we're working together, including even this survey that happened. For instance, we have support from PEPFAR, the US government. We have support coming from the Global Fund. We have support coming from the World Health Organization, who actually, indeed, the technical experts who helped us to do this survey. Mm-hmm. Yes.
Okay, I understand it's an expensive process to treat and manage TB, and of course, you know, 6 months is a long time. Tell us about your experience, Mary, for the 6 months.
Okay, it's not an easy journey because, first of all, you have to take your meds on time, you have to eat right, so you need like moral support from the people close to you so that you don't give up along the way. And you know, when you give up, you have to start again. And if it keeps recurring, I think it's expensive for the government. So you don't want to do that. Then again, it's about your life. You don't want to do a trial and error, so you want to do it right the first time. Yes, till you get through the journey.
It goes a long way if those that are living with people that are suffering from TB understand how to manage it, isn't it, Dr. Eunice?
Yes, it calls for actually multidisciplinary support, both from the community where the patient comes from the healthcare workers in the facilities, from even the government. And the government has played a key role in as far as ensuring that we have adequate resources for control of tuberculosis. And like Dr. Sirengo has just mentioned, the government works in collaboration with other partners, and the government offers treatment for tuberculosis free of charge in facilities. This includes diagnostic investigations as well as treatment. This is availed free of charge by the government. The government of Kenya also capitalizes or ensures that they're up to date with the technologies as far as diagnosis is concerned. We recently have an innovative gene expert machine which usually diagnoses TB with precision, and diagnosis is made sooner, and hence patients are able to be started on treatment much earlier. And the government has also worked very closely with the county governments. We appreciate that health is now a devolved function, so it is working very closely with the devolved government to ensure that TB control activities are actually sustained, so that we pick these missing cases that have gone undiagnosed. And maybe if I could also highlight is that the prevalence survey findings also pointed out to a majority of patients or population that is affected as the young population. And this is the economy drivers. These are the economy drivers in our country. So you can imagine if about 80% of the youth are affected by TB, the contribution towards the economy is also affected in equal measure. The call to the country would be, once you suspect or you have any symptom or indication for tuberculosis, they do not have to be serious signs and symptoms as per what people would think. Just a simple cough of any duration associated with night sweats, chest pain, warrants screening for tuberculosis, because we have seen clearly from the prevalence that we are missing a big number of patients, especially in the healthy population, not the sick.
Okay, now to Mary, you're a young lady, and this is something you probably never thought you would come across. So are you passing on that message to the rest of the younger people who think these things are just for a certain few and not them?
Yeah, I do, and to most of my fellow young people, I tell them to, if you feel they're at risk, instead of waiting for you to get TB, why don't you do the IPT, the isoniazid, which gives you immune for like 2 years. Yeah, just prevent it instead of treating it.
Okay.
Yes.
Yeah, prevention is better than
cure.
cure.
Yeah.
All right. Now, speaking of young people, we have to reel in that other conversation about PrEP. Now, there was a survey that was done, and it was sad to see that most people, especially the younger generation, are actually more afraid of getting pregnant than getting HIV. So this is where you come in, Dr. Sirengo. We have PrEP that will be introduced to Kenyans next month, and it actually has, it will give access to Kenyans to an anti-HIV drug that will protect them from HIV infections. Now that seems to be misinterpreted by the conversations we've heard. I'm sure you can speak more on it.
Thank you, Gladys. Indeed, yes, it's true that we're going to introduce PrEP, which in full means pre-exposure prophylaxis medication. And I'll talk a little bit about the PrEP so that people understand what it is before I talk about who it's meant for. So PrEP is a drug that is used by HIV negative individuals who perceive themselves or have been screened and found to be at risk, constant risk of getting HIV infected. So what it entails is you take a pill every day for a period of at least 1 week for it to be effective. So you are protected after taking it for 1 week. Then you take it for a period of time for the duration that you are at risk. So that is actually a medicine. It's not a vaccine, because you are taking an antiretroviral drug. And this is not a new concept, because we've had pre-exposure prophylaxis for other diseases like malaria. I'm sure, Gladys, today if you're going to Kisumu, you take a pill or two for anti-malaria before you go to Kisumu. So this is the same concept, and it's not a vaccine. So the people that we have outlined as the possible users of this medication, number one, are going to be HIV negative people in a serodiscordant relationship, meaning that one partner is positive and another one is negative, and any other person who feels like they do not have the power to negotiate for safer sex. And this includes people who use drugs, for instance, anyone who has multiple sexual partners. Most of the time people say, okay, sex workers, yes. These are the people that we are rolling out this drug to be used. And we know that it's as effective as up to 96% for those who use it consistently.
Okay, so
Yes.
when you bring in that angle, then are we creating loopholes for those that are saying, okay, this is something that now can protect me. I do not have to protect myself in other ways from the virus?
I know that has been the discussion. In fact, I have a few posts from the youth forums here. And in fact, one of the posts which I want to quote, a young person asks, so is this the beginning of stopping condom production? In a sense, to mean that this is the drug and therefore we don't need condoms. So I would like to correct that and say, no, that's not the correct position. The correct position is that for HIV prevention, we use different methods. We call it combination prevention methods. And a good example is if you're HIV positive, for instance, and you're on treatment, which is one intervention and has been seen as a powerful tool for prevention, it does not mean that you cannot use a condom. The same way, if you're using PrEP, you need to condomize. And you need to do other things. If you're a man, for instance, who has not gotten a cut, you need to go for circumcision, because circumcision also provides protection. So PrEP is going to be given as a package within the other interventions, and it's not a magic bullet for HIV prevention.
Dr. Martin Sirengo, head of NASCOP, talking about PrEP not being a vaccine but a medication. And of course, Dr. Eunice Omesa from the National TB Program talking about TB and the prevalence of the same, and the survivor Mary Mutua, who is healed of tuberculosis. It is World TB Day, so do your part to prevent the same.